So the NATRON trial was a phase 3 randomized double-blind placebo-controlled trial. It was conducted in 40 sites in 15 countries across North America, South America, Europe, and Asia. The trial included patients that were 12 and up. They had a diagnosis of HES with an absolute eosinophil count of greater than 1,000 or more. These patients had to be FIP1L1 platelet-derived growth factor receptor negative. These are patients, those patients have a form of HES called myeloid HES, and the study was not looking at myeloid HES. These were patients that were steroid responsive, and these are patients that had active HES, so had had flares, at least 2 flares in the past 2 months. They had to be on stable therapy for about 4 weeks before starting, and all of the patients had a steroid trial at the beginning of the trial. So at screening, they received 1 milligram per kilogram of steroids for 2 days, and then they got randomized to either be in the treatment group or the placebo group, but everyone had to be steroid responsive, meaning that the eosinophil count dropped with the steroids. Sure, so this study showed that the patients in the treatment group, so the ones receiving Benralizumab, had a significantly reduced time to first HES flare, significantly reduced flare events overall, and this is really important because flares are a problem with HES. It's a very heterogeneous disease. Patients have a lot of clinical symptoms, and the patients in the Benralizumab group really did well, significantly better than the placebo group with having reduced risk of flares and reduced flare events. Yeah, so there were key secondary endpoints that all had really strong results. So the annualized flare rate was significantly lower. Risk of relapse, so hematologic relapse, were patients who developed an AEC or absolute eosinophil count greater than 1,000, so significantly reduced in the treatment group versus the placebo group. Looked at the PROMIS fatigue score, and that's a fatigue survey that looks at how tired patients are, how fatigued they are, how much it impacts their activities of daily living, and significantly reduced fatigue in the patients that received Benralizumab compared to placebo, and that was seen really as early as 4 weeks. So it was a 24-week trial, but we saw some of these effects very, very early for the patients receiving Benralizumab. So the study did not, there are subgroup analyses that are ongoing right now. So we know that the myeloid patients were excluded from the study because we know that these patients respond to other treatments like tyrosine kinase inhibitors. But in terms of the other study groups, most patients that were steroid responsive did respond to this, but subgroup analyses are occurring that will look more specifically at the different subtypes. The safety and tolerability was consistent with what we know for Benralizumab, and patients really tolerated well. Adverse events were equal in the placebo group and the Benralizumab group, and the most common were headache, upper respiratory tract infection, COVID-19. So these are really strong findings to show that Benralizumab is effective in patients with HES, is very effective with improving their absolute eosinophil count, so very good hematologic response, very good reduced risk of flares, very good improvement in fatigue, so reduced fatigue. And this is really an important therapy because it's targeting the IL-5 receptor, and we know that this is a very important mechanism for eosinophils and eosinophil-driven disease. So it's really exciting that this option may be available for patients. I think practically it's safe. It was extremely effective. Patients felt better, they had less flares, they felt less fatigue, and they really did well on it, and we didn't see any safety signals for it. So it's really a great medication for patients with HES. Yeah, so there are some subgroup analyses that will be looking at some quality of life data as well, and there are patients on open label extension, so those patients will be continued followed to see how they do with this medication.